Hi, welcome to another presentation produced by Grow a Strong Family, developed by me, Mara Briere, Certified Family Life Educator, founder and president of When Our Loved Ones Are Stable. That is the ideal time to be developing safety plans and to be discussing it, but we don't always have that luxury. Nonetheless, if you can, when your loved ones are stable, start with each of you agreeing that it is in your mutual best interest to diffuse episodes before they become unmanageable. It benefits everyone to have an attitude of prevention rather than cleaning up after the mess is made. So find out which strategies, if any, that your loved ones are aware of that might be helpful to them. Maybe there's a particular song that they like. Maybe there's a need to be alone for a while. Maybe there's a word that can be used that will enable family members and other loved ones to understand space. That could be a great word. Approach with an attitude of curiosity and respect. Be curious about what your loved ones have identified as of benefit to them. And it's also respectful and mutually respectful to have an understanding that this is in everybody's best interest. So certainly approaching it with an attitude of curiosity and respect just makes good sense. Agree on what symptoms may look like from each of your perspectives, but do this without judgment or criticism. Remember, your loved one has an illness. Would you criticize somebody for how they behaved because of cancer? Makes them more tired, perhaps irritable, they don't want to eat, they feel nauseous, everything makes them feel ill. Would you criticize or judge somebody for that? Then don't do it for somebody who has mental illness and that has symptoms that make them behave or act in ways that are less polite or less than ideal. If your loved one perceives your observations as an attack, don't share them, but do document them in some form so that you remember what you see when you see it. We call those red flags. If you have a clear understanding of what the red flags are for your loved ones, at least you'll be in the position to then take some constructive and positive action. And the other thing that's very helpful to do if we can do it with our loved ones is to have an emergency plan. What we need to do for safety plans is look at what is the information that we need. And I've been using the community-based home support safety plan because it's a great model for developing one with your loved one or for your family. You can choose and there's a document and you can find the document and you the basics here. One of them is to write down or list in one place all of the names, roles, and numbers of individuals who you think will be most helpful to you or your family in a crisis. So you get all your contacts and resources in one place. And the questions to consider, first of all, is there anyone you feel you must notify if there is a crisis situation? Anybody that has to know? Are there any people you think who can help calm the situation? Put them down. Any support persons or professionals you might want to contact. Anyone you might want to call who might be able to help with managing other priorities, for example, taking care of your pets or young children or closing up a house or providing transportation, whatever it is. You want to plug up all the holes so that when a crisis comes, you can handle it without breaking a sweat. If you could call or talk to someone to calm you or your loved one down, who would it be? And again, this was originally developed for community-based programs where the in-home therapist would be working with a family with a child under the age of 22, but it's fully adaptable to anybody of any age. It could be if you could call or talk to anyone to whom you or your partner can calm down, or your parent, whomever it is, that's what you do. The goal of the plan is that it isn't always possible to prevent a crisis. So sometimes the goal of a crisis plan is to manage the situation well or to keep people from getting hurt. The goal might be focused on the person in crisis, or it might be focused on how other members of the family respond. So the things to be considering for the goal of the plan is, what do you want the plan to accomplish for you or your family in this crisis situation? What would be a measure of success in managing a crisis or an episode? Let me tell you, in the very beginning or in the early stages of getting comfortable with an illness that has ebbs and flows, that has times when it is very active and times when it almost appears to be in remission, you may not be able to prevent a crisis. Sometimes something, your loved one gets triggered and you don't know why. Maybe you're away. Maybe it's just something quick and dirty. Maybe, who knows? To have this plan gives you the ability to respond without breaking a sweat. So maybe that's the measure of success, is that it did what it was intended to do. I usually find that for these kinds of situations to be the best goal and the best way to measure it. Did it do what it was supposed to do? Then yay. If you don't feel you can realistically prevent a crisis, what could you do? How could you take a step towards your long-term goal, which is to cut down on the crises or to diffuse them? And again, time is your friend here, because the more practice you get, the better you get at it. And I'm sorry to say that, just like with any other illness, heart disease, diabetes, cancer, we do get opportunities to practice, because there are times when the illness is more active than not. And this is true with any chronic illness. This is true with arthritis. We know that there are certain times of the year when it's really cold, for example, that people with arthritic or autoimmune conditions tend to get worse. So we would have a plan to manage that. This is no different. Mental illness is a chronic illness. What would you like to accomplish as a parent or guardian or partner in managing a crisis? And what could be done to reduce the chance of harm or injury? This is what you look at when you are developing your goal. What kind of actions do you think are going to need to be taken? Only list actions that are going to happen. Don't set anybody up for failure, least of all yourself or your loved ones. So questions to consider: what things can you see yourself doing that will help you achieve your goal? What's worked in the past that you could try again? What actions do you need to take to achieve your goal? What actions could others take? What are the ways you think you could calm the situation down? If you think about trying actions, does it feel like they would work? And remember that your best friend when you're doing this is to remember the word experiment. You don't know at any given time what's going to work, what's not going to work. So experiment with it. It really is no different than training. For example, I have a dog who never needed to be trained not to jump on people. He's not a jumper. He doesn't do it. I had to take him back to training in order to jump up on a wheelchair arm, because that wasn't something he ever needed to learn, because he never needed to learn no jump. So I had to teach him to jump so that a client, he's a therapy dog, could pet him. So we know this with childproofing. We know that there are certain things in the home that you just always, everybody plugs up. But then there are things that are specific to your environment that need to be plugged up based on what your child goes for. Adults with dementias often have these same issues, that we know basics, but then there are specifics. So when you think about it, experiment, find out what's going to. Put together your contacts and resources. This is what the goal of the plan and the action. In Massachusetts, you can go to my website to get your emergency psychiatric services. We have an agency called Advocates. There are other parts of the state that would have a similar agency, where a mental health counselor and a police officer will come to your home during a psychiatric emergency and do an assessment right there. And if you remember to ask them to do things like, don't come to the house with sirens flashing, it is a mental health emergency, they will do the assessment. If they determine that your loved one needs to be hospitalized, they will also take care of it. This avoids an ER visit and the stress of that. And it also ensures that if your loved one does not need to be hospitalized, that the situation is diffused and you can be safe. It's wonderful. There is a new resource that Nancy Pizzo-Boucher has published, should be available any day now, and it's called the Mental Illness Triangle: How to Diffuse Mental Health Crises at Home. And then there's something called the Crisis Text Line, and it serves anyone in any type of crisis, and it provides access to free 24/7 support and information. And it's wonderful. So what's included in a crisis plan is members' information, name and age of member, mental health diagnosis, medical history, list of their strengths and interests. I like to include a picture of our loved one when she's well because it makes your loved ones people, not another statistic having a crisis. Make that personal, make it a whole person. Family information, list of family members who live in the home. Behaviors, the antecedents of previous crisis situation, what has occurred before, things that tend to escalate the situation and things that tend to de-escalate the situation. Make it bulleted list, simple language. Medications, name, type, dose, prescribing physician, pharmacy, phone number, any known drug allergies. Treatment choices, list of interventions or treatments that are currently being used, what has not worked, and what should be avoided. And what are the preferences? Especially if it's inpatient, what facilities are preferred. Professional involvement, the crisis team, family doctor, whoever is involved. Family supports, spiritual leaders, safety concerns. We always say in any family, we want to remove access to anything that's not safe. So put away knives, put away meds, put away guns, anything that could be immediately used as a weapon. Frankly, anything can be used as a weapon, but remove the most obvious ones. And if there is a psychiatric advance directive, meaning this is where I want to go, this is what I want to have happen to me, this is how I want to be treated, if there's a copy, provide it, and resources, which are advocacy groups. One of the advance directives that I really love is called the Five Wishes. And one of the reasons I love it is because it is both a power of attorney and a living will. And it's very specific to the needs of the individual. So there's no guesswork. And you can include a psychiatric advance directive as part of the Five Wishes. Now that we have a crisis plan, what's next? After a crisis plan is completed, share it. It's not secret. Share it with important people in the member's life. And the suggestion by NAMI is to share it with the local crisis team, the MH team or the police. I would do both. If I was going to be accessing advocates, for example, I would want them to have it on record. I would certainly bring a copy of it down to the local police station. That's why in the portfolio I include a picture of my loved one. Create a safe environment by removing any and all weapons and sharp objects, lock up the meds, create a plan that keeps other family members safe, and know that your mental health crisis. Again, in your kit, keep a binder with past history, snacks, things to soothe other siblings if there are siblings involved, change of clothes, basic hygiene supplies. This is very good to have like in a gym bag. Because very often if they are taken right away to a hospital, you don't want to have to be running around assembling in a crisis. Already have it made up and ready to go, especially toothpaste and a toothbrush. Let responders know that this is a mental health crisis. Ask them to come without lights or sirens. Basic info, name of loved one, where they are in the house, best ways to approach. Really good to have some kind of a concrete interest to enable quick connections. If your loved one loves dogs and you can have a canine dog or a therapy dog available, you might want to talk about would you like me to get the therapy dog to come visit us, whatever it is. With Max, my therapy dog, we have offered that, and they haven't taken us up on it, but it is still out there as an opportunity and an offer. Have your safety plan available. Resources that we've talked about, including I'm not sick, I don't need help, and various publications that you can find on our website, on our page on defensive, not offensive, as well as on our page on safety plans and questions. You can get more information at growastrongfamily.org. Call us, and as always, take what you like and leave the rest. We thank you so much for giving us the time and the opportunity to guide your family to safety and better outcomes for you and your loved ones. Thank you so much.